Good.
Assalamualaikum warahmatullahi wabarakatuh. Let me introduce myself. My name is Gapude Poinamo. Name 201030111118.
My name is Mauladi Panjirawan dengan NIM 2010303010
Jadi bidang apa?
My name is Juliana Tritami, NIM 2010-3010-76.
Okay. On this beautiful occasion, we would like to make a speech about why masks are important to use during pandemic area. On Monday, 2 March 2020, Indonesia announced the first 2 cases of coronavirus disease. COVID is thought to spread mainly through close contact from person to person, including between people who are physically near to each other, within about 6 feet. People who are infected but do not show symptoms can also spread the virus to others. COVID-19 spreads very easily from person to person. How easily a virus spreads from person to person can vary. The virus can cause COVID-19 appears to spread more efficiently than influenza, but not as efficiently as measles, which is among the most contagious viruses known to affect people. At this time, we need to revert to the simple yet effective prevention measures that are being shared by the Indonesian Ministry of Health, World Health Organization, and partner in particular on the use of masks. Masks have been recommended as a potential tool to tackle the COVID-19 pandemic since the initial outbreak in China. Although usage during the outbreak varied by time and location, globally, countries are grappling with translating the evidence of public mask wearing to their context. These policies are being developed in a complex decision-making environment. With a novel pandemic, rapid generation of new research and exponential growth in cases and deaths is in many regions. Simple cloth masks present in pragmatic solution for use by the public. This has been supported by most health bodies. Masks are effective only when used in combination with frequent hand cleaning with soap and water or alcohol-based hand rub. If you wear a mask, then you must know how to use it and dispose of it properly. Furthermore, the correct procedure to wear and remove a mask must be followed to ensure the efficacy. Before putting on a mask, clean hands with soap and running water or alcohol-based hand rub. Cover mouth and nose with mask and make sure there are no gaps between your face and the mask. Avoid touching the mask while using it. If you do, clean your hands thoroughly immediately. Replace the mask with a new one after long use or as soon as it is damp. Do not reuse single-use masks. To remove the mask, remove it from behind. Do not touch the front of mask. Discard immediately in closed bin. Clean hands with soap and clean water or alcohol-based hand rub.
Not wearing masks to protect against COVID-19 is a big mistake. In my opinion, is that people aren't wearing masks. This virus is transmitted by droplets and close contact. Droplets play a very important role. You've got to wear a mask because when you speak, there are always droplets coming out of your mouth. Many people have asymptomatic or pre-symptomatic infection. If they are wearing face masks, it can prevent droplets that carry the virus from escaping and infecting others. According to infectious disease expert and senior scholar at the Johns Hopkins Center for Healthy Society, Ames Adalja, MD. Face mask can help protect against many respiratory infections that are spread through the droplet route, and that includes coronavirus and the flu. Speaking to the basis of this recommendation, Dr. Adalja state that virus such as the coronavirus can spread from uninfected person to others through the air by coughing and sneezing or by touching contaminated surface and then touching your mouth, nose, or eyes prior to hand washing. When a face mask is worn, one can prevent those droplets from coming into contact with one's face or mouth before dropping to the ground. Therefore, masks are very important to wear during this pandemic because it can protect you and the people around you.
Okay. The COVID-19 pandemic has persistently affected our biological, physiological, social, and cultural aspects. The COVID-19 case fatality rate is higher than the flu. Until now, there have been still no medicine proven to treat the disease. Many people were so overwhelmed by the abundance of stressing information from social media and internet, which pose a major threat to public mental health. They responded differently from feeling low mood, anxiety, panic attack, and sleep deprivation. Other than wearing a mask, social distancing, also known as physical distancing, is decided to minimize interaction between people living in a wider community in which individuals have tendencies to be infectious but have not yet been identified, thus not yet isolated. Moreover, it is advised for individuals to be apart from another for at least 6 feet, due to the disease ability to be transmitted by respiratory droplet. A certain level of people proximity is required, therefore, social distancing of people to not gather themselves in such areas will reduce transmission. And social distancing is one non-pharmaceutical intervention that can inhibit the virus spreading from infected case to susceptible case by arguing physical distance between people or decreasing congregation in the community in place, such as school, workplace. Social distancing is an essential part of pandemic control in reducing the possibility of the virus spread. Such a policy was once applied to an influenza pandemic in 2009. Social distancing is one of the pandemic strategies against COVID-19 used by the World Health Organization and recognized by China and other countries during the COVID-19 pandemic. By providing a lot of information about infection and disease, it is expected that the community will become aware of and comply with all government regulation aimed at reducing the morbidity rate. It can be concluded that compliance with stay-at-home policy management involves the role of top management level and exert incentives to public. Trusted information and support are required to maintain the society mental health and well-being. Always running the health protocol is a wise step. Always wearing a mask, a healthy lifestyle, maintaining personal and environmental hygiene, and not believing in hoax news about COVID are things that can help us fight COVID. Hopefully, this pandemic will end soon so we can return to normal life. That's all from us. Sorry if there are mistakes. Assalamualaikum warahmatullahi wabarakatuh.